welcome. It is Jen with Aging Advantage. Today, for our educational opportunity, we are going to be discussing a really just interesting topic that I think a lot of you are going to resonate with, unfortunately, I will say. And, it's something that isn't really talked about a lot, like on the medical side where I am, and it needs to be. It's something that, a lot of you guys feel quite often, and especially even, if you're a caregiver for someone, a lot of times we kind of feel like not heard, etc., in medical land. And so, what is this topic we are talking about, you ask? Well, it is navigating medical gaslighting. And, what we're going to do is we're going to be talking about what is medical gaslighting in the first place. And a lot of times just know it, is kind of like the bias, if you will, of like really just like understanding how patient concerns are really just dismissed and what you can do about it. And so, like, an example would be, like you sharing your symptoms or your experiences, etc. And, the doctor's kind of over there, like, yeah, great. Okay. Yep. Next. Um, and you just don't really feel heard. Or you're told like, oh yeah, okay, you're just getting old. That's just what happens. That's just how aging goes, etc. And so we're going to be discussing and the real raw things behind it on both sides of the fence. Again, what is it? And also like the impact that this has on yourself, but also just know as well, it has a massive impact on the medical side as well of care. And also, you guys have heard me talk about that continuum of care phrase, right? But same thing, it has a massive impact, sometimes even on the cost of your medical care, unfortunately, short term and long term. When you are completely basically like not paid attention to, if you will, and not heard and not understood and not listened to. So we're going to be talking about those things. Again, we're going to look for like, how do we recognize when this is happening? How do we know? And like, how do we trust that, yeah, this is, kind of me just being a little extra, or no, like this is a legitimate concern. And how do you get someone medical to like pay attention to what you have going on, again, or for a loved one? And how do you get them to actually like take action when you need them to be taking action for next steps and moving things along, instead of just always like we've all heard this one, okay, well, that's great. We're just going to watch it and see. We're just going to check it again. But it's just a lot of times there's a lot of things that just become stuck on the watch and see list, as I call it. And it's just like, as a patient, sometimes you're like, am I crazy? Like, what is like, I am really experiencing these things. Can somebody please pay attention? And so anyways, we're going to go through that stuff, no, you're not crazy. How do you recognize these things? And then importantly, like, what do you do about it? And who are people that you can implore and bring in and, partner with that can help you to move, some of these things forward so that you do feel heard. So again, like I said, just interesting topic, right? Because this is not talked about enough. And I feel like, especially as our population continues to age as well, these are just important overarching, conversations that we just need to uplift, that we need to be having. And again, on both sides of the fence, like, all of you as patients need to understand and recognize kind of when you're being like put off and kind of dismissed. And us on the medical side, we need to do a better job of, we call it like our bedside manner sometimes, our listening and are validating what kinds of symptoms and concerns that patients, and like you guys have heard me discuss so many times also, like concerns that the family has, or whoever is around that person that also is observing these changes and observing these things going on, and that they're bringing to the table as well as concerns. So they also need to validly be heard. But again, how do you do that? So that is what we are going to be talking about. So again, Jen with Aging Advantage, and Aging Advantage is a nonprofit here in the St. Louis area. We serve St. Louis and the surrounding area, and we do that through grants and donations and incredible partnerships that we have with amazing organizations here locally and also nationwide. So if you find this content helpful, again, this is issues that everyone faces everywhere, not just here in St. Louis. Definitely please share this with someone you know that this might be helpful for. And and again, I try to educate you guys and teach you interesting different things, and really just give you guys like skills and the tools to like empower yourself to speak out, to stand up for your health and what you need and the resources that you need to connect with and align with. And sometimes it's like, how do you do that? What are these resources? And so, we go through all these kind of things on this channel, which is incredible. So, we talk through different things like housing issues, food issues, food insecurity issues, potentially, also isolation issues, getting you guys out there, getting you more social, helping you stay connected. So key for our brain health and our whole entire body health, as we've learned as we went along. But also, helping you guys too to just be more confident and be more self-resilient and also kind of self-reliant, and help to make sure that the environments you are in, your homes and all the things, your vehicles, etc., are safe. And also helping you as well to feel like mentally, emotionally, like physically, all the things like safe, right? In your environments that you're in. And yeah, so that's some of the different things that we discuss here and that I teach you guys about. So for today, like I said, we're going to be talking about navigating medical gaslighting. So sit back, relax, get comfy and cozy, grab a drink, and let's get started. Okay. All right. So again, as we, look at, as we really like look at this topic again, like I said, it's a fascinating one because, a lot of us have heard of gaslighting, but a lot of times we think of that in terms of, like relationships, like more romantic kind of relationships, or maybe like familial, like family dynamics or relationships, or something along those lines. But a lot of people have never really heard of it in terms of, the medical concerns. And, but if you think about it, like you have a, relationship, like a professional relationship, if you will, with your medical teams and your medical providers. So, like, absolutely, this can also happen in this capacity. So, again, I feel really strong about this, and I feel like it's something we absolutely need to address because it affects just so many more people than we often ever talk about or think about. And, the thing is, when it happens to you or somebody that you love, also that you're watching this go down, you're watching this occur, the what is it, and like how to recognize it, again, what do you do about it, and where can you really turn for support? And it's something that I want to say directly to all of you as we begin, and we go any further really, is I want you to understand that and hear this, for me at least, like just know like your symptoms are real and your experiences and what you're going through matters. And they're all pieces of the puzzle that all of your medical teams need to be paying attention to. And so, the entire presentation again is really just dedicated to every patient who has ever sat in a doctor's office and walked out feeling way more confused, like totally dismissed, and feeling like way worse than when they first walked in. And not necessarily because they received a hard diagnosis, but again, like they were dismissed, minimized, or made to feel like they somehow were actually the problem. So if it's ever happened to you, again, you're not alone. And today we're going to be talking about it. So let's start with, what is medical gaslighting? Now, medical gaslighting is basically the term gaslighting, but with like a medical kind of spin on it, okay? So the term gaslighting comes from 1944 film in which a husband deliberately manipulates his wife into questioning her own perception of reality. So the term has since come to describe any situation in someone's valid perception, feelings, or experiences kind of are denied, minimized, or sometimes even like twisted, leaving the other person to feel just confused and really just doubting themselves altogether. And medical gaslighting, specifically here, occurs when healthcare professionals dismiss, minimize, or invalidate, unfortunately, a patient's symptoms or concerns or experiences. And ultimately, it's going to lead the patient, obviously, feeling unheard, super confused, and doubting their own reality. And it can be overt, the doctor saying flatly, there's nothing wrong with you, back at you after you shared something when something clearly is wrong with you. Or it can be subtle, like the tone somebody would have towards you of like impatience or a quick pivot away from your concerns, or an explanation that puts the responsibility back on you without any clinical bias or without any clinical basis or without any explanation on the doctor's part as to why, or the medical professional's part as to why. And here now is kind of where I want to be careful kind of about something though, but just know like the vast majority of healthcare providers went into medical school because they genuinely care about people and they want to help. So medical gaslighting is not always or even usually the result of a bad person or a malicious provider. So like, why does this happen in the first place? And like this slide here kind of really like identifies several different contributing factors. So unconscious bias, unfortunately, plays a significant role. Biases around gender, race, age, weight, socioeconomic status, and more, like really can affect how providers perceive and respond to patients without even being fully aware of it. There are definitely also communication gaps between what patients are experiencing and what they know and how they know to articulate really what they're going through. And between really like what providers are trained to hear, they're listening for those kind of cue words, right? Or those cue phrases to help them diagnose a patient accordingly. But a lot of times, what the medical staff are again just trained and cued to hear, and then the mismatch of some of just these areas of like complex chronic concerns, chronic conditions, etc., that the patients are trying to explain and sometimes don't do a really great job of explaining the symptoms right, etc., or really what they're going through, can really create a really awful mismatch as well. And when you couple some of that from, poor communication on the medical side and the patient side, or their family, again, like, telling half the story to the medical provider sometimes. But when you couple all that hodgepodge miscommunication with time pressures now, especially that doctors, and medical staff they have to now see more and more patients, unfortunately, in less amount of times. Sometimes they don't have enough time to fully hear and address complex or chronic concerns as well. So, when you put all these things together, definitely can create a hot mess. And definitely also a environment, that is just kind of set up to not be the most successful for either party. And these kind of like systematic issues, I'm going to call them, in healthcare that prioritize efficiency over, well, and I should say as well, like cost containment in that way as well, don't always like serve individual patients the best, unfortunately. So all of these factors can contribute then to patients' concerns being overlooked, absolutely brushed aside, or never really investigated properly and fully. Like I was talking about in the very beginning, it's like sometimes you'll get so far and then it's like, well, we're going to just put you on the watch and see how this goes status. And it never gets fully pulled through for all the actual diagnostic things that need to happen for you to actually understand in the medical team to totally know what's going on, for them then to get a proper treatment plan together and you to get going on, whatever kind of medication or lifestyle modification or surgery or whatever, needs to happen from a treatment standpoint. But, all of those things, stuff is being overlooked and brushed aside and not really investigating right, it has real serious consequences sometimes. And and again, like this slide also makes an important point about those people who suffer most. So unfortunately, studies show that marginalized groups, including women, people of color, and those with chronic conditions, are disproportionately impacted by medical gaslighting. Patients in these groups have been told their symptoms are stress related or exacerbated, etc. Or sometimes even, like they're overly exaggerating like how bad they really are, even though, the provider's thinking they're not that bad at all. And so they're kind of telling you that you're being a little extra and you're kind of making it up, right? So what happens then is the patient may wait significantly longer for diagnoses or to receive the right diagnosis, as we just talked about. And they also, therefore, sometimes receive less aggressive treatment for the same kind of condition as a patient from a more privileged kind of group. And so recognizing this, systemic kind of dimension is not really about assigning blame. Please know that. It's just about understanding the full picture, because you cannot address a problem that you can't name. And that's where, change really like has to begin. And so that's exactly what we're doing today. We're naming the problem clearly so that you can recognize it, you can respond to it, and you can actively and efficiently advocate for yourself. The impact of medical gaslighting. So I want to spend some time here really letting the weight of this issue kind of sink in, because sometimes we talk about systemic problems in healthcare, but it can kind of feel abstract. So let's kind of make this concrete. This slide features quotes from Bindi Irwin, and she's the daughter of late wildlife conservationist Steve Irwin. And, we all know most of us know who he was, but he was a very, Steve was very public back in the day, but Bengi has been very public about her experience, for example, with endometriosis. So it's a really kind of painful chronic condition that affects, like inflammatory kind of condition, et cetera, that affects the tissue lining on the inside of the uterus for women. So she spent a decade, which is 10 years. Think about that one. 10 years being dismissed by doctors before receiving her actual diagnosis and then paying attention to her for what was actually going on. So, she described it as trying to keep herself, like keep her invisible illness, I guess, to herself by being told by doctors that it was just a part of being a woman. She also reflected that while some providers were trying to protect her from invasive procedures, she believes that medical gaslighting was a significant part of what delayed her care for a really long time, unfortunately. So 10 years of suffering without a correct diagnosis or appropriate treatment. 10 years of being told in various ways that what she was experiencing was not real or not serious. And I mean, even at that, like she's a very public figure. She has resources, she has education, she has a full global platform, right? So imagine, and I didn't say this to be discouraging, but to underscore the urgency, imagine how this experience plays out potentially even for people with fewer resources, less access, and less ability to keep pushing. They don't have as much even, of that grit to keep forcing the medical conversations to continue to move along. So the numbers bear this out. So studies show that up to 72% of patients, particularly women and minorities, report feeling dismissed by healthcare providers. 72%. That is not a fringe experience. That is the majority. And the consequences are not just emotional, though the emotional toll is also very real. I want you to know that. Medical gaslighting contributes to, like I talked about in the very beginning as well, like massive delayed diagnoses, which means that conditions could have been caught way earlier and treated way earlier instead of caught late when they're much harder and much more expensive to treat. I mean, some of these conditions, like they could have been caught in like pre-cancer stage or stage 1 or, stage 2 or something, instead of it now that it's been pushed and pushed and ignored and ignored. Now, when it's finally, recognized and officially diagnosed, the patient's already now in stage 3 or stage 4 or end stage, of something. And that is like absolutely unnecessary a lot of times. So it contributes, like I said, to just worsening conditions. And people, this is the part that's sad, patients and people will actually just stop seeking care because they just don't want to be dismissed again. Especially for some people that maybe have went to this doctor and they kind of got dismissed, or they got put on the like, we're going to watch and see list, right? And then they went to this other doctor a couple months later when they could finally get in over there, and same kind of thing. So then the patient's like, well, no one's listening to me. What the heck is the point? Maybe it's not that bad, or, or I feel like it's that bad, but like no one's going to pay attention to me no matter what. So they kind of like give up, right? And this can really contribute to anxiety, also depression, etc. And it contributes also to a deep erosion, unfortunately. And this is kind of what makes my heart sink as well, besides all these other things. But it contributes to an even deeper, I would say, like erosion of trust in our overall healthcare system that is a little shaky, that trust in the first place anyways these days, which ultimately makes people feel even less likely to seek care at all about any other body part besides the body part that they're trying to talk to the doctor about in those particular moments that they're being dismissed. And then this creates just a whole entire mess and cycle that can harm people's health even greater and create like even worse outcomes over the long term for patients and for their whole entire body, not just particularly that, like I said, that one body part that they were trying to originally, seek care on. And I think this is especially where for older adults specifically, this issue, really carries a lot of weight because as we age, we are way more likely to be dealing with multiple health conditions, literally head to toe, simultaneously. And the intersection of age with other identifying factors, like when you compound somebody's age, right, with other things like their gender, like their race, etc., can even compound the risk of them being dismissed and not heard and not taken seriously. So there's a troubling tendency, I think, in medicine, absolutely, to attribute like this kind of like symptom. Like I guess I would say like the tendency in medicine really is to kind of, attribute again like these symptoms or like any symptoms, like I was saying in the very beginning, in the older adults to like, oh, yep, you're just getting older. That's just what happens when your body gets older. And in which, okay, fine, fair, fair. Sometimes it's true, but also it can be just thrown out there by somebody on the medical side as a convenient dismissal that again just delays other important diagnoses. So you have the right, please know, to a thorough, respectful, individualized care plan at any age. Getting older does not mean your symptoms don't deserve investigation. It does not mean your pain should simply be accepted. And it does not mean that your sense of your own body, a body you have literally lived in for decades, and you know how it works, you know how it feels when it feels normal, you know how it feels when things are going smooth, that those concerns that you have should not be overridden by somebody who's literally known you for the last 12 minutes of your whole entire life, right? Like you are an expert at your own body. So, I always I always tell my parents that I'm like, you have to advocate for yourself. Nobody else can do it for you. If you have, I guess, like a caregiver or someone like that, that does help you or does support you, etc., those people can, jump in, obviously, right? And they can voice what they are observing, voice what they're seeing, etc. But, at the end of the day, you have to be the one even to communicate and open your mouth. And a lot of times, like, say to them, like, yeah, since I got started on these two new medications, like, I just don't feel right. I don't feel normal anymore. Like, I have brain fog. I'm walking in one room and then I can't remember where I put my cup when I go back in the other room. And I don't necessarily remember, like when I'm driving, even how to get to the grocery store. The grocery store is right around the corner. But sometimes like I turn left and then I don't realize like that I turn left. I don't know why I turn left. And sometimes, I don't know what I'm doing anymore. I can't think clearly since XYZ, whatever it is. Again, like it could be because of a medication that they started. It again could be because maybe we have the beginning of some dementia, Alzheimer's, some process like that starting to happen in the brain. Another thing as well, where you guys all really have to advocate for yourself too. And again, this is like okay, as your eyes get older, this happens, right? So sometimes you just literally can't see as well. So we need reading glasses, right? to be able to see up close better as we age. A lot of people as well, when they get older, they also then have driving glasses because they need to be able to see distance and they can't do that well. We can get things like glaucoma. We can get things like cataracts, etc. And so someone's vision continues to deteriorate. But again, from an observer, looking from the outside in, even as a caregiver, someone in the same house as another person, we might not always observe and recognize all of your struggles that you are having. So that's kind of where, again, that intersection of, okay, this is what I'm dealing with, this is what's really going on, and this is, what I need help with. This is then what you're going to be communicating to the doctor about that you can't see as well. You need a little bit more support in this area, or same thing like to your caregivers so that they can share that information. But that's where, again, like you have to learn to advocate for, these are the symptoms I'm feeling. And even though they're telling you sometimes, again, like the little eyeball example, these are things that just happen as your eye ages. Great. But you have to still say, like, okay, like, yeah, I get that, and that's fine. But these are the symptoms that I'm having, and I'm struggling, and I can't function well. Like, I can't sit on the couch and watch TV right anymore. When I'm driving, I can't see the sign, for where to turn. When I'm reading, I can't see up close anymore. I can't see what my prescription bottles say, etc. Or even like a phone, like I can't see the text on the phone correctly, etc. So, that's kind of where that intersection of a patient knowing what's going on and them being able, again, to share with the provider, like, these are my symptoms, this is what I'm struggling with. And then equally, the provider needing to listen, and those things coming together is ideally how medical care should work. But again, doesn't always work that way. So when we do the second part of this particular series for you all, we're going to go through, again, like, how do we recognize this? How do we know when, okay, the doctor is really kind of pushing me off, they're not listening, they need to be doing something, they're not. And then also, like, what kind of resources do you have? And how do you push back? Respectfully, obviously, but like, how do you push back and say, like, no, I'm not okay with this. Like, I need you to follow through with this. I need you to look into this more. And how do you stand up and advocate for yourself, again, in a respectful, nice way? But how do you get heard and get those things pushed through? Because at the end of the day, like, it's your health. It is your body. And if you don't have your health, you don't have anything, right? It's the most important thing. So we're going to talk about those things. So thank you all for hanging out with me today. And again, if you found this content helpful, or, the series is going to be helpful for this one and then the part 2, please share with anyone, like I said, anywhere. It doesn't have to necessarily be here in St. Louis. And definitely follow us on Facebook and subscribe on YouTube so that you don't miss all the other important content that we share. And lastly, something I want to encourage you all to do too is to comment. And comment on each other's comments, because all of these topics and all these things we're talking about, we're really helping you all to, like, build a community of successful sharing for all of you. I want you guys to be sharing with each other things that have happened and things that have worked and things that you've tried, so that we can kind of help empower all of the rest of you. You can all help empower and teach each other, as well as we go through some of these really, specific and interesting topics. So please do that as well. And thanks again, and we will see you on the next one.